the lives of our people.
Now, elsewhere, thousands of women from Divo in rural Ivory Coast have turned to organic farming and grouped together to gain financial independence. Now, they go to the fields with machetes and dabbers, a traditional African hoe, to farm their produce, which they say helps preserve their health and traditions. Now, Florence Kubo, one of the farmers, says we've thrown out the chemicals. We don't eat vegetables from crops that have touched chemicals, and now we work with our hands. Marie Michel, also a farmer, says the chemicals that we used to spray the soil, the plants and the fruits used to give us diseases, but we are ignorant and we don't know anything else, yet we're always surrounded by it. And since I have known this store, I consume good products. Now to the focus of our conversation today, which is viral hepatitis. Here now is a glimpse of what the disease is about. This is commonly caused by a virus, and this is known as viral hepatitis. You can contract viral hepatitis through contact with the blood or body fluids of an infected person. The 5 main hepatitis viruses are hepatitis A, B, C, D, and E, with the common forms being hepatitis A, hepatitis B, and hepatitis C. The symptoms of hepatitis types A, B, and C may include fatigue, nausea, poor appetite, belly pain, a mild fever, or yellow skin or eyes. Symptoms of viral hepatitis are rarely noticeable, therefore many people are either misdiagnosed or do not come forward for testing.
My name is Mark Mbio. I am 38 years old. Going into treatment through the methadone, we went through some tests, and that's when now I found out that I had hepatitis. It had not reached a stage in which symptoms had started manifesting. However, when I was taken for scanning at the Acute by Medicine du Monde, they said my liver had really been, had corroded, and there was like somewhat fatty. So that's when I, really freaked me out. For me, the biggest factors were sharing needles. I'm a recovering addict. I was just injecting heroin and popping Valiums. And though I tried to be very careful, friends, you try, and I tried to stick with the people who I would say grew up with, and I knew them, but in addiction, you really don't have friends, so that's why I got hepatitis from. One thing that was made very clear was the sharing of needles, but that I had already stopped. I had already stopped sharing needles, and basically something else that I was told was watch what I was eating, to be careful about, especially spicy stuff. There was a medication that I was put on, I think it was 3 months. But it was something that we had to do on a daily basis. I'm grateful for where I am, because I did find love. I have a son.
Oh, congratulations.
Yeah.
Well, that's just a glimpse of what hepatitis is about, and this conversation really is having more information about hepatitis and creating awareness of the same within this month, where we shall be marking the World Hepatitis Day on the 28th of July. Now, to help us along with this conversation in studio, I'm joined by Professor Elijah Songok, who is a virologist, but also the Director of the Research Capacity Building at the Cambry. Thank you for your time. We're also joined from Eldoret by Dr. Faraj Some, who is a specialist physician at the Moi Teaching and Referral Hospital and also a senior lecturer at the Moi University Medical School. And we are also joined by those who live this reality, and they are joining us via phone. We have Josford, who's not using his real name. That's not his real name, joining us from Eldoret. We have Faith, also not her real name, joining us from Eldoret. And we have Joseph Kipkoskei, also not his real name, joining us from Marigat. Thank you all for being part of this conversation. And Dr. Songok, I'll start off with you. I think it is so important for us to be very clear as to exactly what hepatitis is and how it is caused.
Great. Thank you very much, Gladys. Yeah, viral hepatitis, as the word mentioned, is a disease of the liver. It's a viral disease, and the viral hepatitis occurs in 5 forms or 5 types of viruses. We have hepatitis A, hepatitis B, C, D, and E. Hepatitis A and hepatitis E are transmitted orally, that is by contaminated food and water. Majority of the people who get hepatitis A and E mostly fight off the infections and the immune system, and they become quite normal after a particular period of time. So even though at the beginning of the infection is a problem, in the long term is not a big public health problem. That's hepatitis A and E, because it resolves if you have immunity, is very good. The other 2, however, hepatitis B and hepatitis C, are the ones of great public health significance. Hepatitis B and C are bloodborne. They are caused by contaminated blood. B especially, first of all, is transmitted through mother-to-child transmission and contaminated blood, which may be having hepatitis. The other ones may also be through sexual transmission and what is called horizontal, contact between somebody, especially when one child is infected and the other is not. By sharing items, you can easily be able to pass to that particular other child. That is hepatitis B. Hepatitis C mainly is through, as Mark was saying, injection drugs. This is directly through the skin, contaminated needle. Somebody has been infected, have used the same needle, and is infected with hepatitis C, is easily right now transmit to the other one. So it's much more highly prevalent among people who inject drugs. The problem is wide. It's a global problem, both hepatitis B and hepatitis C. Hepatitis B, we have around 290 million people worldwide, globally, currently infected. As you can see, those numbers are really huge because it is nearly 2 times or 3 times that of HIV. Hepatitis C is around 70 million people who are infected globally. When we come to Africa, we get that 60 million people in Africa are infected with hepatitis B, while around 11 million are infected with hepatitis C. Mainly, majority of the people, as you said, who are infected with these particular 2 viruses do not know, because we have little awareness of the infections with these hepatitis viruses. Unlike the other infections like HIV, TB, and malaria, which we have a big hullabaloo about it in terms of information, this one is really less, people have been made less aware. And because they are less aware about it, they rarely go for testing. And when you don't go for testing, then the particular problem persists. So we get that the majority of these particular viruses cause liver cancer, or what is called hepatocellular carcinoma. So majority of the people who are infected with these particular viruses actually have liver cancer. And before they reach that stage, which is called chronic stage of infection, with the hepatitis mainly B, what happens is that they don't know. So it takes some time to become the chronic, and then afterwards, now they become, they have the liver.
All right. Let's bring in Dr. Some. You have been practicing at the Moi Teaching and Referral Hospital in Eldoret. From your experience, which is the biggest burden of hepatitis that side of the region?
Thank you, Gladys. We have both hepatitis A and hepatitis B. We do not have a lot of hepatitis C. Actually, we don't have any on our follow-up at the moment, but we know they do exist because of some of the studies we've done. Hepatitis A, we get it in an acute form, usually young people who come in because of infection, and as you have been told, that the infection is acquired through contaminated foods and water. So it tends to occur actually in people who drink untreated water or water from the boreholes, or who have come in contact with contaminated foods. It's an acute illness and resolves fairly well. A few people may have the disease linger on for up to 2 to 3 months, but usually by 2 to 4 weeks, the disease has resolved. We also get hepatitis B. Some of them come and are diagnosed because they have come in with chronic liver disease. And when they come in with chronic liver disease and we run the barrage of tests, which include hepatitis B, hepatitis C, and HIV, we call it triple serology, is when we actually find out that probably their chronic liver disease is associated with hepatitis B, because most of them will turn out to be positive for hepatitis B. And in our setup, where we've done some studies, we found out that those with chronic liver disease, up to 60% or more, test positive for hepatitis B. So we attribute that as the possible etiology after excluding alcohol use and other toxins that we know can cause chronic liver disease. So those are the two that we come across, and we see them, we follow them up in a liver clinic, which we have set up in Moi Teaching and Referral Hospital, which is a referral center mostly for North Rift, western part of the country, and sometimes it extends even to Nyanza and Lodwar, that's part of North Rift, and part of western Uganda. Some patients actually come from that area. Okay. So those are the two that we commonly see. We don't see much of hepatitis C.
All right. Interesting perspectives there. And let's hear from those that are actually wearing these shoes. And we'll start off with Josphat. As I mentioned, this is not his real name. He's joining us from Eldoret. Josphat, when did you get a diagnosis of hepatitis B?
Yes, good morning, madam.
Good morning.
Yes, first I got tested, and that was in 2019. I went for my first test, and it actually turned out to be positive.
Okay.
Yes, so I was referred to go to Moi Teaching and Referral Hospital for further medication. That is when I found a doctor who actually advised me to go and test my viral load, my DNA viral load. When I tested, it came out that it was too high. I was told to go and rest for some 3 months, then come back and do the second test.
Okay.
I did the second test, that is after 6 months, and I found that the viral load has actually increased to 1.5 million. Oh. That is when I was actually referred for medication. To pick up the medication.
Okay. So what are the symptoms you had that made you go to hospital to seek healthcare?
Initially, I had something like malaria. So I went, I was tested for malaria, it was negative. Then I was tested for typhoid. And then the doctor told me you have typhoid. So he treated me for typhoid, which was actually, I came to realize that it was a misdiagnosis. Because when there was a health awareness week that was going on in the town. So I volunteered to go and test myself for hepatitis B. That is when I realized actually that I was not sick about. I never had typhoid, but it was actually the hepatitis B. That is when I actually went to the district hospital where I was referred to go to the Moi Teaching and Referral Hospital for further medication.
Okay, so when you say you were having malaria, that means you had symptoms that were mimicking malaria. Which were these?
It was I was sweating a lot. Another thing was stomach upset and general weaknesses.
Okay.
The body. Loss of appetite. I was not eating anything at all.
Okay, and as Dr. has mentioned, that hepatitis B is a highly infectious. Were you the only family member with this condition?
In my family, we have a big family. We have 15 of them. And when I realized that I had hepatitis B, is when I actually went back to go and test all those people. I made an effort to test all of them. And it was unfortunate that I came to realize that 3 of us in the family had contracted hepatitis B.
Oh, okay.
So the rest of the family have been vaccinated, and they are doing well. These other ones are going on with their medication.
Okay, let's hear from Felix, who's joining us from Baringo. You are also living with hepatitis B, and it has been 12 years. When did you get, what led to the diagnosis?
Good morning, Madam Gladys.
Good morning.
Yes, I realized I had hepatitis B in the year 2009. I actually developed some symptoms. That is jaundice. There was itching of the body, nausea, and general body weakness. So when I went to hospital, I went to a nearby clinic, given some medication. But later on, I was advised to proceed to Moi Teaching and Referral Hospital. When I reached there, I was tested for or screened for hepatitis B, and it turned out to be positive. Because it's like the situation had advanced, the doctor did some other tests or advised some other investigations to be done concerning the liver. And so one of the tests that they did was liver function test, and they found that the liver was severely attacked. And I was given some medication for 2 months. And then after that, I went for checkup. And it was still there. So I continued with the treatment.
Yes.
Yeah.
Okay, so at this point, had you also investigated if other family members had contracted it?
We did some. We did some after that. We did some screening to actually not only family members but in our community.
Yes.
Because the disease was prevalent. There was a situation where we had lost so many people in that region, and we didn't know it was actually hepatitis. So we knew it was a liver disease. So people we lost a number of people because of liver disease, but we didn't know that the root cause was actually hepatitis B. So we advised the leadership to assist us to do some screening. And it turned out that a number of people also were found to be positive. And one of my family members was found to be positive.
Okay.
One of my parents, yes.
Now let's hear from Faith again, not also her real name, and she joins us from Eldoret. What led to your diagnosis, Faith?
Good morning.
Good morning.
Repeat your question, please.
What led to your diagnosis? What symptoms were you dealing with?
Actually, for the first time, I never knew we had hepatitis. That is until the year 2017, when my mother passed on through liver disease. And that is when we were suspecting we had the disease. So we were taken to the Baringo Referral Hospital, the family of 9, all of us, including my dad. After reaching there, we were tested for the hepatitis, and we realized that the 3 of us had the disease, including me. We were positive. Hello?
Yes.
Are you getting me?
Yes, I am. Continue.
Yes. So that is when we realized we were positive for the disease. We were referred to the Eldoret Teaching and Referral Hospital. That is where we were to be tested for some specific tests like the viral load. And when the results came out, we realized that the 2 of us had a very high viral load. So we were subjected to the medication for 6 months. And that is how I realized I had that disease.
Okay. Were you symptomatic?
No. Yes.
So
maybe the symptoms came, but I was not aware.
Okay. And what were they?
Immediately when I lost my mother, there were some specific symptoms like paining of the liver, loss of appetite. I was not also having a good sleep. That was abnormal sleep. And my doctor told me those are the signs.
Okay, yeah. So Dr. Songok, just listening to all of them, clearly you can hear the symptoms are varied, yet all the patients have hepatitis B. Is there something that is common with this virus, and also is it also the other thing that feeds into a lot of misdiagnosis?
Yes, first of all, as you have heard from the people who are living with it, one issue as we are coming again first was that awareness. You see, the misdiagnosis is coming because when somebody presents with hepatitis, majority of healthcare workers, especially in the subsidiary clinics or in health centers or in district hospitals, may not suspect immediately to be hepatitis. They may actually test for issues like malaria, as you see we had of typhoid. Yeah. For by the moment that actually is noted, even with the jaundice, that it is something much more serious than malaria. It has taken some time, and that's why the referral is actually happening towards like now Moi Referral Hospital. So the issue is if there was that particular much more awareness, could be able to easily be able to be noted much more earlier. The other thing is, as you are saying, is that the symptoms, as I said, is hepatitis and the infection of the liver. And what we call the sequela is nearly all the same in majority of them. And you won't get much a difference in the type of hepatitis with a different type of symptom. Majority of them actually ran similar, yes, irrespective of if it is A, C, or B, or C.
Okay. Now, there is reports that every 30 seconds there is somebody who succumbs to hepatitis-related illnesses. What makes this virus so lethal?
This virus is highly very infectious. And the lethality is that, as I said, it goes and actually affects the liver. So it is the infectiousness of it. The replication cycle is really very fast indeed. And even in terms of, even when it's even outside the body, unlike the other viruses, this virus can survive for long and can infect somebody even after around 7 days. So the lethality is that it's fast replication and also the area where it is targeted, and that is the liver. Yeah.
Okay, Dr. Some, when these patients come to you and they're feeling, you know, they have these symptoms they speak of, what is the first thing you do to ascertain that you are dealing with hepatitis?
Thank you. Normally we take a very good history so that we narrow down the possibilities, and then we run a few tests for other illnesses that can cause fever. But depending on the history, most of them, we do a screening test for them. That is the hepatitis B surface antigen. When it turns out positive, then we follow up with other tests to confirm that it's truly hepatitis B. Then we try to stratify, is it an acute illness or is it a chronic illness that has exacerbated? And we run some of these tests, which we call hepatitis B panel. There are 5 different tests. And through that, then you're able to stratify at what stage your patient is in. And when it becomes necessary, or if you find that it's actually probably already in a chronic phase, then we request that we do a viral load. It's a test that we reserve to the end because it's quite a costly test. And the viral load will actually tell us how much virus is in the system. We also do other supplementary tests, like check the function of the liver, look at their blood picture, look at their kidney function, because all those can be affected when you have a chronic hepatitis B. So through all this is when we have a criteria, is when we actually look through the criteria which was developed, the WHO one, and we have a national guideline on how and when to initiate treatment on individuals who have, or we have confirmed have chronic hepatitis B. When it is in an acute phase, we actually allow the natural process of healing to take place. And the majority of adults, up to 90–95%, will actually recover fully. It's a small percentage of 5 to 10 after 6 months may not recover fully and progress now to the chronic phase. Okay. And that's when actually we want to do the viral load, because by 6 months, the body system should have actually gotten rid of the infection.
All right. Now, I mentioned earlier that according to research, 95% of people living with hepatitis don't even know they live with it. What have you seen with the patients that come to you? Do you deal more of the chronic stages or the acute stages?
We deal more with the chronic stages, unfortunately. I think a lot of the acute stages may not be recognized immediately because it comes as an acute febrile illness, and you've had those affected were actually told they had malaria or typhoid and so on. So that particular phase may be missed. Again, we have a big number who are asymptomatic. They carry the virus, but they do not have any symptoms. However, they can infect other people who are not having hepatitis. So that is probably why we miss them in the early phases when they're in acute phase or when they are asymptomatic, except of course if they go for a medical checkup, it might be picked up, or if they come in for another illness and a hepatitis test is carried out, it might be picked up, or if they go for blood donation and blood is obviously screened for hepatitis A, hepatitis B, C, and HIV, and it might be picked up there. But otherwise, they're probably asymptomatic. But if you talk to them, they may have had a phase of an acute febrile illness, which they thought was flu or thought it was malaria, and it came to pass. that's mostly probably why we see them in the chronic phase.
Okay, so that we can be clear and perhaps people can have a better, index of suspicion, so to speak. What are these symptoms that are unique to hepatitis?
The general malaise, which can happen in all other viral illnesses. They have fever, low-grade fever. They may have a period of yellowness or of eyes, but if they are more observant, they'll notice darkening of their urine. Sometimes people don't look at their eyes, or if somebody else might point it out to them, but darkening of urine, but mostly it's that fatigue. Others may have pain at the site of the liver, which is on the right upper quadrants of the abdomen. And that could actually indicate that they might be having hepatitis. So the yellowness or darkening of urine may be more significant, and the yellowness of the eyes.
Okay, so let's hear again from those that wear these shoes, and I'll start with Felix. When you got this diagnosis, what did that mean to you? Had you ever heard of hepatitis before?
Yes. I knew actually about hepatitis because it is part of one of the topics in high school, those time subjects. But I didn't actually knew much about it, the seriousness it deserves. So, but when I actually tested positive, I was not expecting. Because of the methods of spread. I thought maybe I was okay. But when I was tested positive, then it was a bit shocking to me. But I had to accept the situation later on and move on.
Okay, and how about your family member? Was this an easy pill to swallow?
Oh, it was not easy. Because earlier on, I told you that we had lost a number of people in that community through liver disease. And later on, it was discovered it was actually, the root cause was hepatitis B. So when I tested positive, there was a lot of fear in the entire family that maybe this is a death sentence. But I want to thank God that when I took those medications, God helped me, and I'm still here to testify.
Yes. It's been 12 years later and we celebrate you. This is very encouraging, even on this path of creating awareness about hepatitis. Let's hear from Faith. When you got this news, what did you think about the diagnosis?
Madam, it was not easy. To me, testing positive, it was like really, I had only one day to live. It was like the next day I'll not be there. After going through all that, seeing how my mother was going through that treatment, that pain, to me and my family, it was like really, we will not see tomorrow, but God is good. We are here.
Yes, you are. How long has it been now?
5 years. Yes.
And how is the viral load?
My viral load now, it is minimal. It is about 45 ml.
Yes.
It's very minimal.
Okay.
Yes.
All right. And you're going about your life as usual?
As usual.
Okay. Very encouraging too. Josford, your story, wakati ulipata hii diagnosis, what was the impact?
It was actually like a death sentence, as earlier said.
Yeah.
But I thank God also, because currently, it's now 2 years. And I am doing well. My viral load is actually undetectable as by now. It's zero. Yes.
You mentioned that it wasn't an easy thing for your other family members to accept their status.
It was not so easy, actually, because they're going to tell them you have a chronic illness.
Yes.
It's not such easy for them to accept.
And was this the first time they were hearing about this disease?
In fact, it was the first time because we had somebody who actually passed on, and he had some liver problem. We never knew it was actually this disease. And later on, we came to realize that it was actually that disease. And because of the stigma, the family members of the guy never told us that it was actually the hepatitis B. So we later on learned about it for a very long time.
Okay, and we'll talk more about the stigma in a moment. Dr. Songok, when listening to those that have joined us, clearly it's encouraging to hear that those that are living beyond the diagnosis and have hope beyond the same. Perhaps you can underscore for us the risk factors of you contracting hepatitis.
The risk factors for hepatitis, as I had indicated earlier, Gladys, was that one is mother-to-child transmission. Usually, what happens is the majority of the cases that we see is they got it through the infection on what is called vertical transmission, or the mother transmitted to the unborn baby. And then, because at that particular time, during those particular times, vaccination had not mostly occurred, the stage of acuteness came, and then afterwards it went to chronicity. That's right now what we are seeing in terms of the chronic stage. So the number one actually is the transmission through mother to child.
Okay, maybe to just clarify,
yes.
Are we saying that the adults today could have contracted it from their parents when they were younger?
Yes, majority actually from what we have been following up is that majority actually contacted when they were younger.
Wow.
And that because it took that particular longer period of time, the development actually continues, even that when you can see somebody at the year of 17, 18, or 19, is when right now the chronicity or the chronicity right now start occurring. As some of them actually clear the virus, as we are seeing at the acute stage, but that we are seeing the 10% is at that particular, mostly it occurs at that particular adult stage. So we actually suspect that majority of them may have occurred during that time.
Yes.
The other one is actually sexual transmission, as you said. Somebody has this virus, is infected, can be able to transmit to the partner, as just like HIV, and then afterwards it continues. If the immune system is good for that one, clears it up, and then 10% continues towards chronicity. The others we are saying was the issue of right now contamination, whereby you have like the family. As you are hearing one of the survivors actually is saying that we could be able to get as a team in the family.
Yes.
So could either have been to the vertical transmission where the mother had and then afterwards transmitted, but then the sharing or the sharing of utensils or something like that within the family may have actually got it. And then we are also finding that the issue of scarification or use of traditional methods for whereby the skin piercing. This is something which we are trying to see a very high incidence in particular communities that are still practicing these traditions. And we are thinking that this is a big contributor towards the infections.
Are we talking about circumcision, tattooing?
Yes, such areas, tattooing, circumcision, and mainly scarification, mainly in terms, because there are communities that use, let's say, they pierce the skin so that they can be able to put some drugs or some herbal medicinal. Then when there's a contamination of that particular piercing instrument, they can be able to use it. Then you have right now that they have the hepatitis being transmitted. As I was saying, this thing is very highly infectious. So even a small bit of it, and on a skin that is pierced, can easily get infected, unlike other viruses like HIV. Yeah.
Okay, now we seem to have a burden of hepatitis B, especially in the Rift. We've seen stories of, you know, Eldoret, Baringo. Why these areas?
Yeah, that is, thank you for that question. We have been sampling populations in Kemri. And the samplings that we have been doing is all across the country. The types of populations called sentinel surveillance, whereby we should be able to know. First of all, we have not mounted what said whole country population testing to know the actual situation of viral hepatitis in this country, especially hepatitis B and C. But what we do is that we sample populations, and one of the sampling ways that we use is, first of all, is blood donors, test blood donors, that every blood donor is being tested, or every donated blood is tested. Then afterwards, we could be able to see them once we remove the ones who are infected. Then we could know from the particular regions of the country, we are seeing infection rates of which one has a more high infection. And we are seeing that the area of blood donations that come in from the area of North Rift actually much more higher than the rest of the country. The other sampling that we have been doing was that we go direct to the liver clinics, and then we determine if the particular populations or patients at the clinic, what is the cause of the liver illness. And when we sampled in Mombasa, we sampled in Kisumu, we sampled in Nairobi, and we sampled in Eldoret, we found that nearly 80% of the liver clinic attendees in Eldoret were actually having or infected with hepatitis B, unlike the other red parts of the country, whereby Nairobi is around 20%, when you go to Mombasa, around 15%, Kisumu, it was around 30%. So there is a particular, as you said, more burden of the problem in the North Rift. We are trying to find out why the main reason, but we could only be much more suspicious, because we could only be more just only think that could be because of this. We don't have exactly the real data or the real reason.
Yeah.
Mainly is the cultural practices, because we find that as you come right now from Karamojong to Turkana to West Pokot and so on, those are arid and pastoralist communities. So there may be some particular types of practice that they are doing, which may actually celebrate the prevalence of hepatitis. And our suspicions is issues like scarifications, as I was talking about.
Yes.
The issues of much more of scarifications, the issues of the use of traditional things to pierce themselves, tattooing, maybe because more prevalent in that area. But we could say we don't have enough facts to actually to say pinpoint that this is the main reason that the North Rift has this. But you could actually confirm that in majority of the cases that we are doing the sentinel surveillance, we are having a more higher prevalence in those particular zones.
Okay. All right. We take a quick break here on Your World. When we return, we talk about the stigma associated with hepatitis. Now, this morning, our guests who are living with hepatitis, that is Faith, Josfet and Felix, are appearing or joining us through phone because they do not want to be seen because they're afraid of the stigma associated with the same. And even their family members are a bit more concerned about them coming out in public and saying they're living with this condition. Why is this the case? We'll answer that question right after this break.
Season is here thanks to Notify Mall. Shop from hundreds of online shops at our mega malls along Moi Avenue in Nairobi and Moi Avenue in Mombasa. Notify Mall, all your favorite online brands under one roof.
Did you know at Ruiru Mabati Factory, you can open an account and lipa pole pole at your convenience? Did you know at Ruiru Mabati Factory, you can get customized sizes according to your roof plan to avoid wastage? Did you know Ruiru Mabati Factory offers free delivery countrywide within 72 hours? Call us now on 0111 050 700. Ruiru Mabati Factory, mali safi kwa bei poa.
NTV Jioni, habari za kina, fasaha, tendeti na za kuaminika.
Can you get yourself inside my room? Let me take you up. Take you up. Let me take you down. Lay you down. Let me show you up. Show you up. Let me turn you on. Turn you on. Let me show you some good lo 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 lo. Lo 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 lo. Let me show you good lo 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 lo.
To get Lolo by Omalay, dial star 812 star 804 hash. Skiza na Nation.
Unajua sasa na wanaume wawili ambao wanapenda sana na wananipenda sana.
Richard alishakudamu.
He asked for a break.
Ndio maana alikuwa anataka 2 months break.
So you're the girlfriend.
In fact, Kenya kwenda kuja kuambia ni kama bado unataka tunaweza date.
Tumuuliza? Niko kwa market mimi.
Wewe hatukuwezi tuwe sisi.
Kwangu ni msichana ambaye ananipenda, unanielewa? Lakini mimi bado natafuta tu jambo la kuweza kumkwaza.
Siwezi endelea kunyamaza.
Okay, Ted, unajaribu kusema?
Teddy has been hitting on me.
How desperate are you? Joey, you're pathetic. You have a track record of chasing after men who are nothing to do with you. Like Max.
And Richard left you for who? At Berkeley.
Pieces of Us in association with Nivea Nourishing Cocoa Body Lotion.
It's time to show off your best skin. Wear your skin with pride every time with Nivea Nourishing Cocoa Body Lotion.
Lifestyle Heights, a prestigious gated community in a tranquil environment offering elegantly styled 2 or 3 and a 3-bedroom plus a DSQ apartment, combining tasteful design and modern amenities. Contact us on 0706 155 277 or 0726 205 208.
Thank you for staying with Your World. My name is Gladys Gachanja. Today we are creating awareness around hepatitis. And of course, this is happening ahead of the World Hepatitis Day, which will be marked on the 28th of July. And this is done annually. And helping us along with this conversation is Professor Elijah Songok. He is a virologist and also the director at the Research Capacity Building at Cambridge. Dr. Faraj Some joining us virtually from Eldoret. She is a specialist physician at the Moi Teaching and Referral Hospital in Eldoret, and of course also a senior lecturer at the Moi University School of Medicine. Also joined by those living with this condition. One is Josford, Faith and Felix, all living with hepatitis B. And let me mention that these are not their real names, and we'll get to why they are using their pseudonyms in a moment. And Daktari, there is a question that has come to you, if you can have it on the screen. Okay, we have a question here from Evelyn Mbabu, who says, you've talked about all the other hepatitis. What about hepatitis B? Kindly touch on it. Hepatitis D, yes.
Thank you, Gladys. Evelyn, hepatitis, as we said, there are the 5 of them. We cannot say much about hepatitis D. hepatitis D does not occur alone. The infection of hepatitis D occurs on people who are already infected with hepatitis B. So it rides on hepatitis B. So if you don't have hepatitis B, you rarely get hepatitis C. So it's actually use the conditions for hepatitis B to be able to ride on it. So it is not as very much significant as currently, causing those particular types of illnesses that we are saying about when it is within hepatitis B. So hepatitis B actually is a major. And when we have carried out some evaluation of prevalence of hepatitis D among patients who are infected with hepatitis B, we find that it's actually minimal. But we'll say that the moment we hit hepatitis B, or the treatment that we give for hepatitis B, always take care also hepatitis D.
Yeah. Okay, that's a good clarification.
Yes.
Again, there is A, B, C, D, and E, with the most common being A, B, and C. So let's talk about the stigma, and that's why those living with this condition today are joining us through phone calls, because they do not want to be seen. Felix, you've been living with this condition 12 years now, yet stigma is still something that is an issue for you and amongst your community. Tell us more. Okay, we seem to have lost the phone calls, but we'll get back to those in a moment. Dr. Some, what is this that fuels the stigma within these areas, especially when it comes to hepatitis?
Stigma is still real because a lot of people do not seem to understand about hepatitis. There is also fear that hepatitis B in particular seems to be associated with a fatality. So when people, particularly family members, hear of it, they'd rather keep it under wraps because they don't want to be isolated by the rest of the community, because they feel the community would be afraid to interact with them, so that just in case they get infected. So that seems to perpetuate the stigma. And mostly, like I say, it's because of lack of information about it. It's like when HIV came. You remember people didn't even want to shake hands, isn't it? And it's almost the same with hepatitis. And yet we know that that's not a common mode of transmission. So it's lack of knowledge, lack of information, lack of awareness, plus the fear that if they contract the disease, it's associated with fatality.
Interesting. Now let's hear from Felix. What is your greatest fear about this condition or that of your community members?
As I said earlier, when the community realized that the disease actually it killed a number of people, there was a great fear in the whole community. And once you are diagnosed, it's like a death sentence. And worse still is the mode of transmission. That mode of transmission of this disease is almost like those ones also of HIV, AIDS. And there was a lot of stigma in the community, because once you are diagnosed, it's like now you are gone. So in fact, it reached a point where most of the people feared going for screening because of that stigma. They'd rather stay with it without knowing their status than getting screened and turning out to be positive. So it is. There's still a lot of work that needs to be done actually to fight that stigma, because it is real. And it's affecting the community, even the people fearing to screen themselves, their status.
Yes.
Yeah.
Okay, and Josphat, it has also been said, and it's one of the risk factors, that hepatitis B can be sexually transmitted. Has this been an issue also that has fueled the stigma for you?
Thank you so much. Stigma is real. It's real because whenever someone knows that you have hepatitis B, nobody actually wants to associate you with him or with her. So the stigma is real, and that is the main challenge. You find that most people do not want to be screened. Somebody just says, "Wacha inipate mbele."
Okay, and you also mentioned accepting to live with this reality is also another issue. Is it really about the living with a chronic illness, or the fact that people will think I contracted it in this way?
The main challenge first is for you to accept that this thing is real. And the issue of other people is that whenever they hear you have hepatitis B,
yes,
they will actually avoid you as much as possible.
Interesting. We're still trying to get Faith to join us, and she can tell us her experience. But Dr. Songok, I mean, as we've heard, when HIV came, there was also a lot of fear about it because of how lethal it was and also how many people did not know. Is this the same thing we're replicating today with hepatitis? And why has it taken so long for this kind of awareness?
Yeah, I say, as Dr. Sombe and the participants have said, is actually the biggest issue is awareness that is bringing this particular stigma. When HIV came, it was the same thing. We rode on the same issues of stigma, but with much more information, much more communication, explaining how it is transmitted, how it's not transmitted, how you can get it, how you cannot get it. Slowly, the stigma went down, and then people came up and they could be able to talk or give their own personal stories that you are seeing, and that it is not actually a death sentence. So in that way, the stigma went down. So it is one thing is actually, one thing is to awareness. Because we can create awareness, we shall be able to get much more people coming testing. And right now, you can link that up to treatment or to care. The issue, as you're saying, is that how we could be able to work much more is that we have been trying, especially to the national programs, like now the coming in of national the hepatitis dates, to much publicize this particular issue of hepatitis. One thing that we have been challenged about has been the resources going towards hepatitis. While majority of resources have been going to the big three with the Achilles, and you can see that hepatitis is more bigger than the big three.
Yes.
That's HIV, malaria, and tuberculosis. Not so much had been actually resources had gone to hepatitis. But we have been happy, but the last 4 years, we are seeing the Global Fund now starting to support issues of hepatitis. The World Health Organization, the World Health Assembly has actually indicated or has put hepatitis as one of the SDGs. So in that way, we can now be able to get the momentum to actually show that much more resources towards awareness, towards treatment, and towards prevention can go to it. So it was actually the thing is that where it is on the priority list, which was not so much up there, but currently I think we have the momentum. When there is so much advocacy, the civil society and so on are actually put, and we are now getting, let's say, issues, advocacies from people who have been infected to really push this forward. So as of now, we think we are getting some traction. As you have seen the last hepatitis days, we are getting much more slowly getting people to know, but still the challenge is so big. But with more resources, we can right now be able to focus on creating this awareness and reducing the stigma.
Now, Dr. Soma, it's been highlighted that even healthcare workers also have a challenge in recognizing hepatitis. So what more can be done to ensure at least those that are focal in helping along with the process of prevention and curative can actually understand what they're facing?
Thank you. I think it's more education. We need to make them aware that it does exist and that not every febrile illness is malaria or typhoid or brucellosis and so on, so that they pay a bit more attention to the individuals. I think health education, I think continuing medical education to the healthcare workers and general awareness, even with the public, would help to actually get hepatitis recognized early so that they seek treatment early. That's what is been lacking. But I must say the last few years, there's a bit more awareness, even from the public. A lot of people are coming up, especially if they have been in contact with somebody who is diagnosed, or a family member, or a friend, or they just want to know their status, they come up. And like before, when somebody looking healthy thinks they shouldn't be having any infection in themselves if they're not sick.
All right.
So awareness is better now.
Okay, at least we're making strides towards the right direction. Now, I understand we have a question for Dr. If we can have that on the screen. And remember, our question of the day today to you is, have you ever contracted any form of hepatitis? Are you living with hepatitis? Share that experience with us. #NewNormal. We have Nora Henrietta who says, this is important information. When we were young, some of us got vaccinated against hepatitis. Should we count ourselves safe? Dr. Songok.
Yeah, thank you very much for that question, Nora. The vaccination actually has been a game changer in hepatitis B. We don't have a vaccine for hepatitis C, but hepatitis B, vaccination has been the biggest, actually, what could say, the greatest benefit that we have got. People right now who are, I think, 18 years and below are actually protected from hepatitis if they were vaccinated. So if you did get your vaccination, you don't need to worry, because the people that we are really much more worried right now are the ones who are 19 years or 20 years above. But the childhood vaccination or the child immunization that brought in the vaccination actually they brought in a very big game changer in terms of hepatitis prevention. So if you could be able to get as many people to be infected, if you could be able to have the child dose of hepatitis, we have little to worry about that.
Okay,
Yeah.
so you're saying now the ones you're worried about are 20 and above. What can those do? Can they also go get the vaccination at this point?
Yes, we are promoting vaccination. We are promoting vaccination for adults. And if you could be able to get a vaccine or be vaccinated for hepatitis C, it's a very cheap vaccine. And it is available. If you could get that, that actually will be great indeed in terms of preventing you from getting the infection as an adult. So as you are seeing also during the World Hepatitis Days, when the Health Information Days, we urge people to go for the vaccination, as an adult, because we know that at least majority of the kids have been covered. So yes, we agree, and we really need that people who are 20 years and above should be get vaccinated, and it's available.
So we are only targeting the B. How about the other hepatitis?
Hepatitis A is also having the vaccine. So usually they always come together as A and B. Majority of them come together.
Okay.
So both of them, A and B, have the vaccine. Hepatitis E, not yet. We don't have a vaccine yet, but I say it's solved. Hepatitis C, we don't have any vaccine. So, but the good part of hepatitis C, unlike hepatitis B, is that there's a cure. So people who are infected with hepatitis, even though right now still we are getting the cure right now, as maybe Dr. Some will say, we are getting majority of the people right now who are worldwide infected with hepatitis C have access to a treatment which clears this particular virus within 12 weeks, if you could be able to access it. Hepatitis B is, as you could say, can only be managed. The moment you have reached the chronic stage, it is management by treatment with antiretrovirals. You, like HIV, we cannot clear hepatitis B. So people really have to be able to manage a lifelong disease the moment it has gone to the chronic stage.
Okay.
Yep.
All right. And still in line with the same, one of the 3 winners of the 2020 Nobel Medicine Prize, Charles Rice, said discovering the hepatitis C virus and paving the way for a cure has renewed enthusiasm in people to see if we could achieve that for other chronic viral infections like hepatitis B and HIV. Listening. Okay, we do not have that for the moment, but I'm sure we'll be getting back to that because it's important even as strides towards getting vaccines and treatment for this hepatitis continues in the world. Now, let's take a look at some of the treatment options out there. So for you, Felix, what was the treatment line for you? You said you went on antiretrovirals, right? Felix? Felix, are you still with us?
Yeah, I'm still with you.
Yes, so you went on?
Yeah, in 2009.
Yes.
I was given those antiviral drugs. I started with lamivudine. For 2 months after that, I still tested positive for surface antigen. Then I was advised to continue for another 6 months. After 6 months, I went back again. After 1 year, it was still there. So I continued with those drugs. After 2 years, I think there was some resistance. So the doctor referred me to Eldoret Hospital to another specialist, gastroenterologist in Eldoret Hospital. And the doctor actually gave me a combination of 2 drugs. And I'm still proceeding with those medications up to now. And the condition is stable. I'm okay. I'm going on with normal life. And I want to thank God so much because of that.
Okay. How about you, Josford?
Okay, thank you. It is now 1 year since I've actually started using the medicine.
Yes.
And it has actually proved that it is so effective. Now, I did my DNA viral load test and it actually turned out that it is undetectable right now. That is after 1 year, 2 months.
Okay, and how do you feel? Do you ever have any symptoms or you're back to yourself?
I'm back to normal life. No symptoms. I'm doing well. I'm going on with my everyday duties.
Okay, interesting. And let's hear from Dr. Some. Even as you're treating these patients, is there any worry that they could be infectious when they are on medication?
Thank you. The aim of medication in hepatitis B is to actually halt or stop progression of the infection. It's not a cure. It actually just suppresses the virus so that the virus doesn't multiply and continue damaging the liver. So in this instance, it's lifelong. When we start it, we discuss with the patient and tells them that really there's no room to stop at the moment unless science gives us new information. So we suppress the virus to undetectable levels. When it is undetectable, it's unlikely to be infectious to other people. However, we still want them to take the precautions because you never know with some of these viruses, they change, they mutate, and they might, a new strain might come up. But as long as they are virally suppressed to undetectable levels, they're actually safe to themselves and unlikely to infect other people.
You say you ask them, you say that you ask them to still be cautious. What is this caution that they need to take? That if they have a cut on their skin, an open wound or something, it has to be covered so that their body fluid or blood does not come in contact with other people they are close to. We get them to keep checking and to just ensure that all those modes of transmission are taken into consideration. All right. And when it comes to sexual activity, is it critical that they actually use protection at all times? We do advise that, but we know how difficult it is. So when they are fully suppressed,
virally suppressed to undetectable levels, then normal sexual activity is actually safe. We say safe in quotes, but we know also that their spouses, usually we have vaccinated them. If the spouses are negative, we get them vaccinated so that they have the added protection. Let me add that the vaccine actually is almost 100% protection, gives 100% protection, 98 to 100%. However, after 10 years, we need to have an individual check their level of efficacy, and if it's dropped, then they get a booster. But for many years, almost up to 20 years, the vaccine is safe. An individual is safe after vaccination.
That is good news. Okay, now even as we are talking about treatment for those with chronic hepatitis being lifelong, I wonder who covers the cost of this treatment. Felix, who has been catering for these for you?
Initially, the medications, I got them at Moi Teaching and Referral Hospital. And sometimes I also used to buy them in hospital. But it was a bit challenging initially. But later on, when I was actually linked to a doctor in the Eldoret Hospital, who advised me to go to the CCC. They actually talked to the CCC in hospitals, and that is where I got my medications. But when I came to now the Barnet County Referral Hospital, it was a challenge. You see, those are the drugs that are being used by the HIV patients. And sometimes hepatitis B, there's little awareness, and maybe it is not actually included as much. So sometimes you have to explain yourself comprehensively that you also require to use those drugs, because I realized some of those personnel would not understand that there is need to use those drugs also to fight hepatitis B. So they know HIV, but hepatitis, you have to go through a long process for you to be given those medications.
Okay, so Felix, are you saying you used to access these drugs, or you access the drugs for free?
Yes, initially I used to buy, but later on I was assisted to get from those facilities, CCC.
Okay, now before Dr. Songok actually chimes in, let me hear from Faith and Josford. Faith, what's your experience accessing treatment?
Madam, it was not easy. In the first time I realized I was supposed to undergo medication, I never knew it was given with those people who are having HIV.
Yes.
So I had to buy for 6 months. And that is me for treatment, really. But for other tests, I realized it's really expensive test. Like for you to do a viral load, you are supposed to pay at least 21,000 for a viral load hepatitis.
Okay.
And all this, to me, to a person who doesn't have any insurance cover, it's expensive. And also for you to go to any hospital and explain yourself, it's like there is no much awareness for hepatitis B.
Okay. Josfat, are you resonating with what Felix and Faith are saying?
That is very true. That is the biggest challenge that we have, especially on screening. The screening itself actually costs some money. Like when you go to MTRG, it actually costs you 1,000 shillings for you to be screened. So you find that somebody who has no money cannot actually be able to afford screening alone.
Yes.
Another thing is testing of these viral loads. they're extremely very expensive, and they're actually done on private health facilities. So you find that they are so expensive. The LFTs also are also done at there are some done at the public hospitals. Some are done at the private health facilities, and they are also extremely very expensive. So you find that we have the NHIF. We are contributors of NHIF, but the NHIF actually does not come in any way for those people living with hepatitis B. So we really urge the government to look into it so that those components should actually be factored in. That is the main challenge people living with hepatitis B actually face.
Okay, we have had from all those living with the ones we are hosting this morning, living with hepatitis. Daktari, how can we help them?
Yes, Gladys, I think you have, as Jospat and team has mentioned, there's a challenge in terms of accessing treatment for hepatitis B. One is that people who are infected or who are co-infected, HIV and hepatitis B, actually have better support than people who are infected with hepatitis B alone. This is because there has been a policy that when somebody who is infected with hepatitis B and HIV, they will be able to access the antiretrovirals free. So that has been going on. So people who are co-infected usually has been accessing the CCCs, and they have been having that particular support. The problem which is been occurring, as you say, is only the ones who have mono-infected with hepatitis B. So we are now trying, especially through the ministry and policies, to see that they can also access, unlike the counterparts who are both having the two infections, these can also be included in the CCCs or the platforms that we are using for HIV. But as Jospat has indicated, actually the major number one problem that we are experiencing currently is the laboratory. The tests for viral load and for screening and confirmation for hepatitis B are actually very expensive. So we are hoping that, or we are happy to push that, as he says, if NHIF can be able to use it, or we can be able to have as a policy to support patients who are infected with HIV to access care and treatment by paying these particular expenses, specifically for, if the drugs will be available free through the HIV mainstream channels, then the testing should really be also be supported, so that if NHIF could be able to come in, it's really going to be help in terms of these particular patients accessing a better management system. So I agree with Jospat. Let's really focus and let's advocate and lobby for NHIF to really include hepatitis C as part of their treatment support systems.
And for Dr. Some, even as we take a short break, I mean, all the three patients have said going to explain themselves in these hospitals is also another deterrent to adhering to medication. How are you addressing this challenge?
Like I said, we are making healthcare workers aware of the problem, and that it's not like before where there was no treatment for hepatitis B. Actually, treatment for hepatitis B came about during investigations, looking at drugs for HIV. So that's one good thing that came out of the HIV pandemic, that it was then found out that some of the drugs are effective. However, the society still has not understood, and unfortunately, some of our healthcare workers still have that lack of knowledge. So it's really upon us to educate them and make them aware, so that these kind of questions do not arise, because I know sometimes it puts patients on embarrassing situations, and many times you have us as the providers have had to call them and say, yes, they don't have HIV, but give them this medication, they also work.
All right.
Let me add that currently, a lot of our HIV centers are providing the antiretrovirals for hepatitis. And even in the return, it's not like a favor, but the government is recognizing and is now accepting, because in their returns, when they make their returns for the drugs, they also account for the drugs that they use for hepatitis B patients. So they are provided for. However, it's not been made public for reasons that is still not clear. But in future, I see it like one of those that will have to be taken care of alongside HIV clinics, because they are able to access the drugs all the time.
Okay, on that note, we take another quick break here on Your World. When we come back, more on hepatitis, and also we hear more from those living this reality. We'll be right back.
Get yourself an aerial decoder plus 1 month free classic bouquet at only 999 Kenya shillings, or a satellite dish decoder plus 30 days free smart bouquet at 2,699 Kenya shillings.
What do you think about Molfix?
Actually, another brand was recommended to me, but it had a leakage problem. Then I decided to try Molfix. His clothes don't get wet anymore.
Because Molfix provides extra protection against leakage thanks to its anti-leakage elastic barriers.
All babies deserve a high-quality diaper.
You should also try Molfix.
Akili, 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 akili. Will you wash your hands with me? I want to wash my hands with you. Come on, I will show you what to do. Wash your hands in clean water. Wash your hands, wet them with the water. Wash your hands, now add some soap. Scrub your hands in the soap and water. Scrub above and below between the fingers too. Scrub under your nails and scrub-a-dub-a-doo. Rinse your hands in water. Rinse them clean, rinse away the soap. Dry your hands and go.
Akili, why do we wash our hands?
To wash away the germs.
Akili, what are germs?
They're like tiny little bugs on your hands, and they can make you sick.
But I don't see any germs on my hand.
That's because they're so tiny that you can't even see them.
Oh, wow. I want to wash the germs away. Will you wash your hands with me, Akili?
Of course!
Lifestyle Heights, a prestigious gated community in a tranquil environment offering elegantly styled 2 or 3 and a 3-bedroom plus a DSQ apartment, combining tasteful design and modern amenities. Contact us on 0706 155 277 or 0726 205 208.
Thank you for staying with Your World. My name is Gladys Gachanja. We are creating awareness about hepatitis this morning ahead of the World Hepatitis Day that will be marked on the 28th day of July. And actually, the theme for this year is that hepatitis cannot wait. We'll delve further into that even as we understand the impact of the pandemic on hepatitis. But before we get to it, let's take a look at the other world. And divers explore mock sunken city, play chess and navigate through caves as they experience Deep Dive Dubai, the deepest swimming pool in the world, reaching 60 meters.
Deep Dive Dubai is really, I would say, the most unique facility in the world. It's not only a 60-meter deep pool, which puts it 50 meters deeper than anything else, and more than twice as large as anything else in the world. But that's not even the most interesting aspects, really. It's themed as a sunken city, which is fascinating for divers, free divers, and scuba divers to explore. It's appointed with all the latest technology, 56 underwater cameras served up to the surface deck and a dive safety station, sound speakers down to 15 meters. We have lights throughout, more than 150 lights throughout, and the ability to control mood by closing out shutters and blacking out the facility and then adjusting the light intensities throughout the facility. The design of Deep Dive Dubai was centered around a facility that called back to the UAE pearl diving history. So the shape of the building is in the shape of an oyster.
Well, elsewhere, goats eat vegetation in a suburban Los Angeles grazing area to help prevent fire hazards. Now, the move we looked into, the more we realize how effective this actually can be. And this is according to a fire marshal in Glendale, California.
The overall goal for us is to create a defensible space. It's to basically create a buffer. And that's twofold. That's one, to prevent the spread of wildfire from the wildland interface to a structure. And it's also to be able to provide enough defensible space, buffer around it for us as firefighters to come in during an event and actually protect the homes in a safer environment. And the more we looked into it, the more we realized how effective they can be. We realized how environmentally friendly they can be and the long-term benefits that potentially can arrive from utilizing goats. There's always that threat of injury to personnel. Most areas where within our ordinance, we're still able to physically get up there, but these goats are amazing in terms that it seems like they climb up those with no problems.
Essentially, they can create a defensible space between development and open space without bringing in a lot of heavy equipment or a lot of man hours. So it's a really labor efficient way of doing things. Doesn't create any kind of erosion. The animals are very light on their feet. Goats have 4 stomachs. So by the time whatever they ingest comes out the other end, the seed is non-viable. And that is a really unique attribute of using grazing animals that a lot of times if you mow or you weed whack, it literally scatters the seed everywhere. So you're really promoting the establishment of more unwanted vegetation. Found the carrot, huh?
Interesting conservation perspective there. Now, at Tokyo's busy shopping and business area of Shinjuku, a giant 3D cat is displayed on a 4K billboard to greet people. Now, I thought it was a real cat, says a pedestrian while passing by and taking photos.
Well, I think it's really cute. Yeah, it's so cute. It actually looks really real. And I feel like when you look at social media and like the difference, it's like really pretty, and yeah, I feel like that's really cute. Bigger.
Back to our conversation of the day, which is creating awareness around hepatitis. And I had mentioned earlier, one of the three winners of the 2020 Nobel Medicine Prize, Charles Rice, says discovering the hepatitis C virus and paving the way for a cure has renewed enthusiasm in people to see if we could achieve that for other chronic viral infections like hepatitis B and HIV.
The success of these drug treatments for hepatitis C and the fact that you can actually eliminate the virus, you can actually cure people, you can get rid of it, I think has renewed enthusiasm in people to see if we couldn't achieve that for other chronic viral infections like hepatitis B and HIV.
Just some of the strides that are being made in dealing with viral hepatitis. And unfortunately, with the world facing a pandemic, some of these strides have been curtailed. And Daktari, this is something that has become very, very obvious, not only in the country, but also worldwide. What are some of the challenges you're facing?
Yeah, Gladys, the issue of the coming of COVID actually has been a setback to other infectious diseases, focused to other infectious diseases. Not only the issues of malaria, HIV, and so on, but it's also hitting hard on our focus on hepatitis. One of the areas that COVID has done is that we have repurposed our platforms that we have been using for hepatitis, let's say for testing, to right now deal with COVID. So you get that all our laboratories are right now only focused on testing for COVID, or mainly COVID. And then the other infectious disease, mainly hepatitis, has been left or has been put aside. The other is also the workers. I mean, healthcare workers are much more right now focused on the issue of COVID. So other diseases like hepatitis have taken the back seat. Then see now the airwaves, the information, publicity, awareness, resources have now been more channeled as currently as to COVID. So as you are seeing, you are saying during your the news brief, so currently is 180 million people are infected with COVID.
Yes.
But if you see hepatitis B is 290 million. So you could see that actually we really need to repurpose or to claw back these particular resources we have put up to COVID, again also to see that we continue with our fight on hepatitis B and hepatitis C and all the other hepatitis. So as you say, we cannot wait. It's like the theme of this particular year is that we should not wait. We should not say, have COVID cloud us, that we forget the issue like Josphat and the team are really fighting currently. So we need to make sure that at least the resources that have been voted in for hepatitis, we claw it back to hepatitis, even though in the face of COVID.
Yeah. Now, Dr. Some, in the face of this pandemic, some COVID-19 protocols, prevention protocols, have also discouraged some patients from accessing health facilities. Have you seen in the case of hepatitis? You are muted. Please unmute yourself.
Yes, sorry. Earlier on, we know, of course, when COVID came, there was a lot of fear and so on. And a lot of centers actually almost closed to routine follow-up of patients. And we did close our continuing chronic disease clinics, even in MTRH. So we found that some patients actually did not know what to do because there was no alternative arrangements made at that time. All concentration was on COVID. So some of them did miss their drugs. A few of them managed to look around and see how to go around it. And follow-up then was disrupted. We also know that COVID itself has had an effect on the liver, because COVID is a viral infection and it can affect the liver as well, and by the direct effect on it. It can also affect the liver because of the overwhelming immune response that comes on. And this again has been a concern for those who have hepatitis B. Fortunately for us, we haven't come across any of our patients who have hepatitis B who contracted COVID. But we believe that it would disrupt the status quo because it does have a direct effect in itself, or even the drugs that are being used do affect the liver as well. So COVID as it is actually making people also afraid to come to hospitals. Some patients would rather be away because they are well, and you give them a phone prescription or something rather than come for follow-up. So we may miss some of the things that we usually check when patients come to routine clinic follow-up.
Are you afraid that this could feed into the burden of hepatitis in this country?
It's still difficult to say. It is difficult to say.
Okay, let's hear from Felix and Josephat. Felix, have you been shy about accessing hospitals to get your drugs during this pandemic?
There was a challenge during the outbreak of the COVID. Sometimes you would go to hospital, and you also find the healthcare workers are also afraid because they don't know whether you've contracted the COVID or not. So sometimes they would even move away from those services. Sometimes I remember that one of the times they gave me the drugs for a longer period, and they told me, please don't come, just go and use these drugs, because we don't know the situation of, we don't know the conditions of the COVID for this period. So lucky enough, I think I used those drugs for quite a number of times before I went back. So, but for most of us, it was a challenge accessing those facilities during that period.
Okay, and Josephat, has it been a challenge accessing the ARVs at this time, and especially at a time where there seems to also be been a challenge of accessing ARVs even for the HIV patients?
Yes, there was a very big challenge during the outbreak of COVID-19. Everything was actually disrupted, especially in the health centers and health facilities. Hepatitis B patients actually face a myriad challenges, because you could actually find that you may go to a health facility and you find that there is nobody there to attend you. But the most important thing is, or the good thing is that most of our follow-up doctors actually use the phone prescription. You could actually text or WhatsApp, and he or she could actually give you the prescription. You go just and collect your medicine.
Okay, and Dr. clearly adherence to medication is vital in suppressing the viral load when it comes to hepatitis. Are there any forums that are set up in the community level to ensure that these messaging continues even when the healthcare workers are not there?
Yeah, I think it has been a challenge. The issue of continuity, especially outside the hospital, has not been structures that we have put up in terms of informing them to continue with their medication. We have counselors and who are supposed to be working with the community level, but majority of these particular patients actually were supposed to be working with the counselors to be able to follow them up. But as you see, as issues of also resources and the issue of COVID may have actually has disrupted the majority of this. So we will need really to have that particular strong follow-up, especially when situations like this. I mean, COVID has taught us a lot now, that we cannot be able to continue depending on a particular one channel. We should be able to purpose ourselves, especially fix things to other areas that we could be able to supplement what we will do. So yes, it is a challenge to be able to get that information going, that please continue with the medications and the dangers of you not continuing with the medications, especially when they could be able to access. As you see what the patients are saying and what Dr. Some is when it was closed, they could not be able to access it. So we have now as your planning methods that, okay, there can be a time like this that there can be no access to the hospitals, and right now how we could be able to repurpose the communities to support these particular patients.
And even as we bring this conversation to a close, Dr. Some, they say prevention is better than cure. Even as you cater for your patients, what is this information that you share with them and even to the communities to ensure that we kind of keep hepatitis infections on a minimum?
Thank you. I'd like those particularly adults 18 years and above to know that it's important to know their status, because there is an effective vaccine if they are negative. And if they are positive, it's not the end of the world. We can follow them up, and when it's necessary, they can be put on antiretrovirals to actually allow them to lead a normal life and to prevent them from going into chronic liver disease, liver cirrhosis, and hepatocellular carcinoma. That is what we fear most.
Okay, and I mean, Felix, 12 years later, and you're here to tell that it is possible to have a life and a quality life at that beyond that diagnosis. What would you like to encourage others that walk in your shoes?
I want to encourage them to do screening, and once they are found to be positive, there is life after that. Because since I started using those medications, I've led relatively a normal life. And in fact, one of the breakthroughs that I saw is that actually I want to say when I contracted this disease, so when I tested positive, I had not married, and I had to take my fiancée for vaccination.
Yes.
And right now, all my 3 kids are negative. My wife is negative, and it's only me who is proceeding with those medications, and life can be okay. So I encourage them to take it positive.
Yes.
And we should not stigmatize those who have the disease.
Very well said. Asante sana, even for joining us. And for you, Josfat, your words of encouragement?
Thank you, Madam. First, I would like to request those people who have not actually screened themselves to volunteer and go and screen themselves. If they are negative, go for vaccination. If they are positive, there is medication and there is life after that. So, if you are positive, avoid drug abuse, avoid alcohol, eat a lot of fruits, that is, eat wisely. Don't avoid a lot of things that are unnecessary for your health. Otherwise, there is life after testing positive.
Very well said. And Dr. Songok, before I hear your parting words, I hear there's a question for you. If you can have this question on the screen for Dr. Songok. Are we ready with the question? All right, we have Moses Sigmoid Maramba who is asking, between hepatitis A or B, which one is dangerous, A or B? I think you had touched on this, but please, Dr. reiterate.
Yes, I could say, Moses, both are infectious, hepatitis A and B. But the much more that we really have a big problem with is hepatitis B. Because hepatitis A, if your immune system is good, you get infected and actually you fight it off. But hepatitis B is, it goes to chronic, and that's what is called the liver infection or the liver disease. So I could say between the two, you have a higher chance of fighting and clearing hepatitis A, but the chance of clearing hepatitis B and causing a lifelong problem is much more greater. Okay.
All right, and your parting shot even as we continue to create awareness on hepatitis.
Yes, my parting shot is, as the team has said, one is that one is vaccination, vaccination, vaccination. Get to the test. If you could be able to get for a test if you are 18 years and above, and you test negative, please vaccinate. The moment you get the vaccination, you will not have an issue with hepatitis B or hepatitis A. More forcefully, I would really urge healthcare workers, because those are the frontline guys, and they are really very highly exposed to pricks and so on, we are really encouraging healthcare workers to really manage to really get vaccinated. And if they do get vaccinated, it is not a very expensive issue. I mean, you could be able to access it wherever you are. What you have been seeing is that has been some discouragement of healthcare workers to get vaccinated. We hope that you could be able to, all of you get vaccinated. Even the general population, vaccine. Testing, we have platforms for testing. If you could be able to get to any public health hospital or even a private hospital, request for vaccination, for a test. And it's a very simple test. Surface antigen hepatitis B, you could be able to actually have it, even simple rapid test, and you could be able to know that. So the two things, it starts with knowing your status, and knowing your status is by testing, and if you are negative, protecting yourself lifelong by vaccination. So those are the two things I would be able to really urge, that awareness, let's know as we are coming to the World Hepatitis, this is a World Hepatitis Month, World Hepatitis Day, let's keep the awareness so that majority of the people can know about the dangers of hepatitis. And those ones who know, go for testing, negative, go for vaccination. Thank you.
Very well said. Yeah. Professor Elijah Songok, virologist, Director, Research, Capacity Building at KEMRI. Dr. Faraj Some, who joined us from Eldoret. She is a specialist physician at the Moi Teaching and Referral Hospital, which is MTRH, and of course a senior lecturer at the Moi University School of Medicine. We had Josfert, Faith and Felix join us, who all live with hepatitis B, and they were brave enough to actually share the journey with us. And unfortunately, we did not get to see their faces because of a stigma around this condition. But as it has been said here over and over again, by creating awareness, the stigma will also be dealt with, because people will understand what the condition is about, and the fact that even as the doctors have reiterated, when you get the diagnosis, there is a life after that, because there are treatment plans that are in place to give you such. Well, that has been your world this morning. Tomorrow, my colleague, that is Victor Kiprop, will be on the steering wheel. Now, remember, it passed in 2019, and I'm talking about the Kenya Personal Data Protection Act, which was designed to bring the protection of personal data from misuse in Kenya into the 21st century. Now, at a time where Kenyans have found themselves registered by various political parties without their knowledge, among other incidences, where are the loopholes? Victor Kiprop will sit down with various experts to help answer that and many other questions tomorrow from 7 a.m. See you then.